The way you think is not just a philosophical or psychological matter, it's a biological reality. Your thoughts are not abstract clouds floating aimlessly in your mind. They are real electrochemical signals that shape the way your brain and body function. And when it comes to health, both physical and mental, your thoughts can either be the architect of resilience or the saboteur of well-being. Let's begin with the fundamental understanding of what a thought actually is. At a biological level, a thought is a pattern of neural activity. Neurons, specialized cells in the brain and nervous system, communicate with each other through synapses, creating circuits. These circuits are shaped by experience, genetics, and learning. Every time you have a thought, you activate a specific set of these circuits. Over time, repeated thoughts strengthen those circuits, a phenomenon known as neuroplasticity. Neuroplasticity is the brain's ability to change itself. This means the brain is not a fixed organ. It rewires itself in response to experience and behavior, and because thought is an experience, your patterns of thinking actually alter the structure and function of your brain. This is the first way thoughts shape your health. If you consistently engage in thoughts of fear, self-doubt, resentment, or hopelessness, your brain gets better at producing those patterns. Conversely, when you practice thoughts of calm, gratitude, and self-efficacy, you sculpt a brain that defaults to those healthier states. But the story doesn't stop at the brain. The brain communicates with every organ system in the body, particularly through the autonomic nervous system and the endocrine system. This is where your thoughts start to shape your biology in very direct ways. For example, when you think a stressful thought, like anticipating failure or feeling social rejection, your hypothalamus activates a cascade of hormonal responses that prepare the body for fight or flight. Cortisol, adrenaline, and norepinephrine are released into the bloodstream. Your heart rate increases, your digestion slows, your immune response is temporarily suppressed, and glucose floods into your muscles. This is a brilliant adaptation for a short-term threat, but when your mind is constantly generating stress-based thoughts, that emergency response never fully shuts off. Chronic stress thought patterns lead to chronic physiological stress. Over time, elevated cortisol damages tissues, disrupts sleep, suppresses immune function, and contributes to weight gain, particularly in the abdominal region. It also impairs memory and learning by damaging neurons in the hippocampus, a critical brain area for cognitive health. The immune system, in this state of suppression or chronic activation, becomes dysregulated. This is why people under persistent psychological stress are more prone to infections, autoimmune disorders, and even cancer. Thoughts of anxiety, guilt, or shame are particularly potent in activating this stress cascade. They don't need to reflect objective reality to have a biological impact. The brain responds to perception, not truth. If you think you are in danger, the body prepares as if you are. If you feel unworthy, your physiology reflects that emotional state, even if no one else sees you that way. This is why mental reframing and cognitive reappraisal are such powerful tools. Changing your interpretation of an event, even slightly, can significantly reduce the physiological load of that experience on the body. Let's look at the flip side, the healing power of constructive thought. Thoughts that promote a sense of agency, hope, and connection activate entirely different neurochemical systems. When you think about someone you love, when you feel a sense of purpose, when you recall a success, your brain responds with a release of oxytocin, dopamine, and serotonin. These chemicals promote bonding, reward, and calm. Oxytocin in particular has powerful anti-inflammatory and cardioprotective effects. It can lower blood pressure, reduce pain perception, and even enhance wound healing. Dopamine, often misunderstood as just a pleasure chemical, is actually a signal of motivation and drive. When your thoughts focus on attainable goals, dopamine helps you move toward them with energy and persistence. This doesn't just affect your psychology, it strengthens the immune system, enhances motor performance, and increases resilience to stress. And serotonin, often associated with mood regulation, plays a role in everything from sleep to appetite to digestion. Positive thoughts don't mean naive optimism or ignoring problems. They involve an accurate assessment of reality coupled with a belief in your ability to influence it. This is known as self-efficacy. It's one of the most powerful predictors of long-term health outcomes. People with high self-efficacy recover faster from illness, are more likely to adhere to medical regimens, and experience fewer complications from chronic diseases. The placebo effect is another compelling example of how thoughts shape biology. In clinical trials, people given sugar pills, believing they are receiving real medication, often experience real improvements in symptoms. This isn't fake healing. It's a demonstration of how belief triggers neurochemical responses that can relieve pain, reduce inflammation, and initiate tissue repair. Placebo responses have been observed in everything from depression to Parkinson's disease to post-operative recovery. This doesn't mean we should replace medicine with thoughts, but it underscores how powerful the mind-body connection truly is. And then there's the nocebo effect, the dark twin of placebo. When people believe they are at risk or anticipate negative side effects, they are more likely to experience them, even if they received a harmless substance. This is not a psychological illusion, it's a physiological reality. Expectations shape outcomes for better or worse. The thought becomes a biological event. Another key mechanism through which thoughts shape health is through sleep. Thought patterns influence whether or not you can fall asleep, stay asleep, and enter restorative sleep cycles. Rumination, worry, and mental overactivity activate brain regions such as the prefrontal cortex and the amygdala, making it harder to transition into the calm, synchronized brainwaves required for deep sleep. Lack of sleep, in turn, dysregulates emotional processing, impairs memory, increases appetite, and weakens the immune system. It's a feedback loop. Negative thoughts impair sleep, and poor sleep amplifies negative thinking. Breathing is another bridge between thought and physiology. Thoughts of anxiety and fear alter breathing patterns, making them shallow, rapid, and erratic. This, in turn, reduces oxygen delivery to the brain and muscles, heightens arousal, and feeds back into the cycle of anxiety. But here's where the system is beautifully designed. Breathing can be used to interrupt the loop. Deliberate, slow breathing, especially extended exhales, can calm the autonomic nervous system, lower heart rate, and reduce the intensity of stressful thoughts. This isn't just meditation, it's physiology. You can leverage this bidirectional relationship. Thoughts affect breath, and breath affects thoughts. The same is true for movement. Physical activity changes brain chemistry. Aerobic exercise increases brain-derived neurotrophic factor BDNF, which supports neuron growth and repair. It also boosts dopamine and endorphins, which elevate mood and reduce pain. The more active your body, the more resilient your brain becomes to stress. And yet, what determines whether or not you get up and move? Often, it's thought. The internal narrative of "I'm too tired" or "it won't help" shuts down the very behavior that would change the brain state. But when you shift the thought, even subtly, to "I'll just do a little," the cascade reverses. The action confirms the new belief, and biology follows suit. Social connection is another domain where thoughts shape health. Feeling isolated or rejected activates the same brain circuits as physical pain. Chronic loneliness increases the risk of heart disease, dementia, and mortality. But here's the twist. It's not just the amount of social contact that matters, it's the perception of connection. Two people with the same number of relationships can have vastly different health outcomes based on how connected or supported they feel. And that feeling is driven by thought patterns, how you interpret interactions, whether you assume goodwill or rejection, whether you focus on gratitude or scarcity. Even immune cells respond to thought. This may sound surprising, but it's well documented. The brain communicates with the immune system through a network of chemical messengers. Stressful thoughts upregulate pro-inflammatory cytokines, while calming, hopeful, or purposeful thoughts can downregulate them. This is part of the emerging field of psychoneuroimmunology, a discipline that explores how mental states influence immunity. It's not metaphysics, it's measurable. Now, none of this means that thoughts alone can cure all diseases. That would be irresponsible and unscientific, but the role of the mind in health is far more significant than most people realize. It's a contributing factor, not the only one, but a powerful one, and the good news is that thought patterns are modifiable. You can train your mind just like you train your body. Practices like mindfulness, cognitive behavioral therapy, gratitude journaling, and even simple acts of reframing a situation can rewire neural circuits over time. The critical point is this: the brain is listening to the stories you tell yourself. The body is responding to those stories. The immune system is responding. The hormones are responding. Your sleep, your digestion, your cardiovascular system, they are all downstream of what you think repeatedly over time, so the invitation is not to force yourself into positivity or suppress difficult thoughts. It's to become aware of the patterns, to interrupt the loops that are harming your biology, to engage the ones that promote growth, healing, and adaptation. Thought is not just a mental event. It is a biological force. And you are not at the mercy of your thoughts. You are the architect of them. Your nervous system is designed to be shaped by your attention and your intention. When you recognize this, you step into a new kind of power, the power to influence your own health at the deepest levels. This mind-body feedback loop becomes even more profound when we examine how early life experiences and environmental influences shape habitual thought patterns that persist into adulthood. A child who grows up in a nurturing, secure environment is more likely to develop internal narratives rooted in safety, competence, and trust. Conversely, early exposure to neglect, unpredictability, or trauma can wire the brain for hypervigilance, anxiety, or low self-worth. These formative patterns become the lens through which the individual views the world, often without conscious awareness. Over time, they calcify into persistent thoughts that subtly or overtly guide behaviors, emotional responses, and physiological states. But these patterns are not set in stone. Because of neuroplasticity, the brain can rewire itself across the lifespan. What this means is that even long-standing mental habits, those that seem automatic or ingrained, can be shifted through intentional practice. Meditation, for example, has been shown to alter both the structure and function of key brain areas involved in attention, emotion regulation, and self-awareness. Functional MRI studies have revealed that consistent mindfulness meditation can decrease activity in the default mode network, the part of the brain associated with self-referential thought and rumination. At the same time, it strengthens the prefrontal cortex, which enhances executive control and reduces impulsivity. One of the most striking areas where thought influences biology is in the context of aging. While cellular aging is influenced by genetics and environmental exposure, it's also shaped by psychological factors. People who hold negative beliefs about aging, such as thinking that decline is inevitable or that older adults are less valuable, are more likely to experience cognitive and physical decline themselves. On a cellular level, this is partly mediated by telomeres, which are protective caps on the ends of chromosomes. Chronic stress and pessimistic thinking have been associated with shorter telomeres, which are a marker of accelerated aging and increased disease risk. On the other hand, individuals who view aging as a phase of growth and opportunity tend to maintain better physical health, cognitive function, and even live longer. This isn't about wishful thinking. It's about recognizing that your interpretation of life events, your internal dialogue, and your emotional tone have tangible effects on your cells. Every thought has a biological footprint. When you think differently, your brain releases different neurochemicals, your endocrine system responds accordingly, and your immune system adapts. Even gene expression can be influenced by mental states. This field, known as epigenetics, has shown that while our genetic code is fixed, the way genes are turned on or off is influenced by the environment, including the internal environment of thought and emotion. Let's look at another example: chronic pain. Pain is not a purely physical sensation. It is constructed in the brain, and while it often originates in the body, the intensity and persistence of pain are heavily modulated by psychological factors. Thoughts of helplessness, fear, or catastrophic thinking about pain actually amplify the sensation, This is due in part to the brain's predictive coding system, how it anticipates and constructs reality. If the brain expects pain, it can generate the experience even in the absence of injury. This is seen in cases of phantom limb pain, where individuals experience real, excruciating sensations in a limb that no longer exists. Conversely, shifting the perception of pain through cognitive restructuring, guided imagery, or biofeedback can decrease pain even when tissue damage is present. The power of thought extends into the realm of immune-mediated diseases as well. Autoimmune conditions, in which the body attacks its own tissues, are influenced by stress and emotional states. Research has shown that people with higher levels of psychological stress and unresolved trauma are at greater risk of developing autoimmune diseases such as rheumatoid arthritis, lupus, or multiple sclerosis. While these diseases are complex and multifactorial, it is clear that the immune system listens to the brain. Cytokines, small proteins that regulate immune response, are sensitive to stress hormones and mental states. Positive mental practices, including mindfulness and self-compassion, can reduce inflammatory markers and modulate immune responses, potentially influencing the course of disease. Cardiovascular health is another domain where thought plays a critical role. High levels of hostility, chronic worry, and pessimism have been linked to increased risk of heart disease. These mental patterns are associated with higher resting blood pressure, greater arterial stiffness, and elevated levels of circulating stress hormones. On the other hand, traits such as optimism and emotional resilience correlate with lower incidence of cardiovascular events. Notably, these associations persist even when controlling for traditional risk factors like diet, exercise, and smoking. What this tells us is that mental habits are not just extra to our health, they are embedded within it. Cognition itself, our capacity to remember, learn, and problem solve, is deeply influenced by our mental landscape. When we are caught in cycles of negative thinking, the prefrontal cortex, which governs rational thought and decision-making, becomes less effective. Simultaneously, the amygdala, a region involved in emotional reactivity, becomes hyperactive. This impairs our ability to learn, to hold attention, and to make sound judgments. Stress-related thought patterns also interfere with neurogenesis, the birth of new neurons, particularly in the hippocampus, a region essential for memory. This means that not only can negative thoughts impair your current mental performance, they can shape your future brain in ways that decrease cognitive vitality. In contrast, cultivating curiosity, gratitude, and mental flexibility appears to support brain health. These thought patterns encourage the growth of new synaptic connections and promote adaptive learning. They also improve emotional regulation, making it easier to recover from setbacks and maintain internal stability. When people engage in acts of gratitude, for example, studies show consistent changes in brain activity, increased parasympathetic nervous system tone, which promotes rest and repair, and reductions in inflammatory markers. Gratitude literally shifts your internal chemistry. It's also important to understand that not all negative thoughts are harmful. What matters most is how you relate to them. Occasional doubt, sadness, or frustration is a normal part of human experience. But when these thoughts become chronic, habitual, and unchallenged, they start to reshape the brain and body in maladaptive ways. Awareness is the key. When you become aware of a thought, you create a space between the stimulus and the response. In that space, there is room to choose a different path, one that supports your health rather than undermines it. Language plays a pivotal role in how we structure thought. The words we use, internally and externally, create frameworks for perception. If you constantly tell yourself you're failing, that you're not enough, or that things will never improve, your nervous system responds to those words. Conversely, changing the language you use can shift the underlying thought patterns. Saying "I'm learning" instead of "I'm failing," or "this is temporary" instead of "this is hopeless," can create significant differences in emotional and physiological response. This isn't about denial, it's about guiding the system in a direction that supports adaptive functioning. The concept of attention is central to all of this. Where you place your attention determines which circuits are activated in your brain. Attention is like a spotlight, and whatever it shines on becomes more salient, more powerful. If you habitually direct attention toward problems, threats, or deficiencies, those aspects of your experience become dominant in your perception and biology. But if you train your attention towards solutions, strengths, and possibilities, those neural pathways become reinforced. This is not just about thinking happy thoughts, it's about training the mind to orient toward what enhances function and growth. Training attention can be done in many ways, through meditation, breathwork, deliberate reflection, or even visualization. Visualization, in particular, has been shown to activate many of the same brain areas involved in real physical experiences. Athletes use it to improve performance. Patients use it to prepare for surgery and reduce anxiety. Imagining positive outcomes, rehearsing difficult conversations in a calm way, or mentally stepping into a state of strength or peace can literally prime your brain and body to respond in more effective ways. These practices are not fringe. They are supported by a growing body of neuroscientific research. They demonstrate that the human nervous system is highly responsive to intention. We are not passive recipients of biology. We are active participants in shaping it. And while we cannot control every variable, genes, environment, randomness, we can influence the way our biology unfolds by the quality of our thoughts. This capacity for influence comes with responsibility. It means that neglecting your thought life is neglecting your health. It means that the stories you tell yourself matter, not just for your mood, but for your blood pressure, your immune system, your pain levels, and your longevity. It means that investing time in mental practices, no matter how intangible they may seem, is as crucial as nutrition, exercise, or sleep. And it also means we need compassion, because not all thought patterns arise from choice. Many are rooted in history, in experience, in trauma. Changing them is not always easy, and sometimes it requires help, from therapy, from community, from new perspectives. But change is always possible. The brain remains plastic, the body remains responsive, the system remains open to influence. That's the incredible truth at the heart of all of this. Your thoughts are not just internal echoes, they are powerful, physiological agents. They can elevate you or erode you. And every day, with every thought, you are shaping not just your mind, but your health, one neural signal at a time. And as we look even deeper into the influence of thought on health, we come face to face with one of the most overlooked yet vital aspects, the role of expectation. The brain is an expectation machine. It is constantly predicting what will happen next, and these predictions are based on past experiences, emotional conditioning, and deeply ingrained beliefs. This predictive coding system governs not only what we perceive, but also how our body prepares and reacts. If you expect to fail, expect to suffer, or expect pain, your nervous system preemptively creates internal states that align with those forecasts. This means your heart rate might elevate, your muscles might tense, and your immune system may be suppressed, all before anything external has even occurred. The mere thought that something might go wrong triggers a cascade of physiological responses that can wear down your system over time. Conversely, the expectation of healing, of growth, or of success can activate the body's restorative systems. This isn't magical thinking, it's neurobiology. Studies on the placebo effect have consistently shown that when individuals believe a treatment will work, even if it's inert, their brains release real neurochemicals like dopamine and endorphins. Regions involved in pain modulation, motivation, and mood regulation light up in synchrony with that belief. The physiological outcome isn't imagined, it's measurable. This phenomenon demonstrates that belief is not a soft variable. It's a biological event with ripple effects across the entire organism. And if belief alone can trigger healing pathways, it follows that our daily thought patterns, what we believe about ourselves, our relationships, and our potential, hold immense power over our health trajectory. The reverse is also true, as seen in the nocebo effect. If a person expects negative side effects or deterioration, even a harmless substance or situation can produce very real symptoms. This means that negative thinking, left unchecked, can initiate and amplify illness not just in the mind but throughout the body. Our perception becomes our biology, not in an abstract or metaphorical way, but through concrete shifts in neurotransmitters, hormone levels, immune activity, and neural connectivity. Let's also talk about identity and self-concept. The way you define yourself has direct implications for your biology. When a person internalizes labels like "I am anxious," "I am broken," or "I am weak," those identity-level thoughts don't stay in the mind. They shape behavior, emotional patterns, and physiological tone. They influence how the brain filters experience, how the body reacts to stress, and how energy is allocated for healing or survival. On the other hand, shifting one's internal narrative to "I am learning," "I am healing," or "I am adaptable" initiates a cascade of change, not only in how we feel emotionally, but in how our cells and systems organize themselves. Thought becomes identity, identity becomes behavior, and behavior becomes biology. This becomes particularly relevant in recovery from illness or trauma. People who develop a sense of agency, who believe they can influence their outcomes, who see themselves as active participants in healing, tend to recover faster and more completely. Their thoughts mobilize the body's natural healing mechanisms. In contrast, individuals who feel helpless or resigned often experience slower recovery, more complications, and greater overall physiological wear. These aren't differences in willpower, they're differences in how thought interacts with neurophysiology. Empowering thoughts increase vagal tone, enhance mitochondrial function, and regulate cortisol output. Disempowering thoughts do the opposite, so when we talk about recovery, resilience, and longevity, we are fundamentally talking about the quality and direction of internal thought patterns. Another area where thought plays a central role is in sleep, one of the pillars of physical health. Insomnia is often sustained not merely by external stressors, but by anticipatory thoughts: what if I don't sleep, or I won't be able to function tomorrow. These types of recursive, anxious thoughts activate the sympathetic nervous system, raise cortisol levels, and keep the brain in a heightened state of alertness. The paradox is that the more you worry about sleep, the more elusive it becomes. But the introduction of calming, regulating thoughts before bed, thoughts rooted in safety, trust, and acceptance, can initiate the transition into the parasympathetic state that promotes deep, restorative sleep. And sleep, in turn, enhances emotional regulation, immune function, and cognitive performance. It becomes a reinforcing loop where healthier thoughts support better sleep, and better sleep improves the mind's ability to generate healthier thoughts. Appetite and digestion are similarly influenced. The gut-brain axis is one of the most powerful feedback loops in the body. Thoughts of stress, fear, or shame can disrupt digestion, lead to inflammation in the gut lining, and alter the microbiome in ways that compromise immune defense and nutrient absorption. This isn't just psychological. The vagus nerve carries signals from the brain to the gut in real time, modulating everything from enzyme secretion to peristalsis. The mind and digestive system are in constant communication. And because 90% of serotonin is produced in the gut, disturbances in this axis can feed back into mood and cognition, creating a self-perpetuating cycle of discomfort and dysregulation. But the good news is that conscious mental practices, such as mindful eating, body scanning, or guided relaxation, can re-establish harmony in the gut-brain connection, leading to improvements not just in digestion, but in overall energy, focus, and immunity. Let's also bring attention to physical performance. Athletes have long understood the power of mental rehearsal. Visualization techniques that involve mentally simulating a movement or competition not only increase confidence, but also activate the same motor and sensory pathways involved in actual execution. This primes the nervous system and improves coordination, timing, and strength. Thought becomes preparation, but the implications extend far beyond athletics. Anyone recovering from injury, learning a new skill, or trying to build endurance can benefit from directed mental rehearsal. The nervous system treats imagined experiences as partially real. The act of thinking about moving a limb, overcoming a barrier, or succeeding in a difficult task literally strengthens the neural circuits responsible for those actions. In this way, thought doesn't just precede action, it becomes an essential component of action, Resilience, the ability to bounce back from adversity, is also grounded in cognitive and emotional flexibility. People who are able to reframe situations, who can find meaning in difficulty, and who maintain perspective under pressure show more robust immune responses, faster wound healing, and lower markers of inflammation. This mental adaptability is not just a personality trait, it's a trainable skill. It involves strengthening the prefrontal cortex, calming the amygdala, and maintaining internal coherence during chaos. It is built through practices like journaling, perspective taking, mindfulness, and emotional processing. These activities might seem soft or optional, but they are neurologically and immunologically active. They change the landscape of the brain and body over time. In social contexts, thought shapes relational health, which in turn affects physiological health. The way you interpret others' behaviors, whether you see them as threatening, supportive, indifferent, or meaningful, has a direct impact on heart rate variability, blood pressure, and hormonal balance. Chronic thoughts of suspicion or resentment keep the body in a low-grade stress state. In contrast, thoughts of appreciation, forgiveness, and empathy trigger the release of oxytocin, which lowers inflammation and promotes cardiovascular health. Thought, once again, becomes a biological regulator, shaping the internal state in response to perceived interpersonal dynamics. And perhaps one of the most hopeful aspects of all of this is that small changes in thought, consistently applied, produce cumulative effects. A single positive affirmation won't change your biology overnight, but repeated over time, paired with felt emotion and intention, it begins to lay new tracks in the brain. The more often a thought is repeated, the more entrenched the neural pathway becomes, and the more effortlessly the brain defaults to that path. This is how habit formation works in the cognitive realm. Just as repetition builds muscle, it also builds mental architecture, and just as physical training produces muscular endurance, cognitive training produces emotional endurance. We also can't ignore the social and cultural layers that influence thought. Media, community, family norms all shape the default narratives running through the mind. Recognizing these influences allows us to choose more deliberately which thoughts we endorse and which we question. Developing an internal locus of control, where you believe your thoughts and actions matter, is correlated with lower cortisol, better immune function, and greater subjective well-being. Thought is not only shaped by biology and environment, it is also a tool to shape those very forces in return. This recursive nature of thought gives it unmatched power. It is the architect of perception, the initiator of emotion, the driver of behavior, and the shaper of health outcomes across time. And when all of this is taken together, when we look at neuroplasticity, epigenetics, the gut-brain axis, predictive coding, stress physiology, immune modulation, and behavioral conditioning, we come to a profound realization. The inner world is not isolated from the outer one. The quality of your thoughts is not separate from the quality of your health. They are part of one continuous feedback system in which every moment of awareness, every chosen belief, every reframed thought becomes a building block in the biological system that sustains your life. The nervous system is always listening, and your thoughts are its language. In conclusion, your thoughts are not just fleeting mental events. They are powerful biological commands that shape your brain, your body, and ultimately, your health. The science is clear. What you consistently think about, how you interpret your life, and the beliefs you hold about yourself all influence your stress response, immune system, hormones, and even genetic expression. Whether it's through reducing inflammation, improving sleep, enhancing recovery, or promoting longevity, the mind is a critical driver of physical outcomes. This means you have more control than you've likely been taught. Your health is not just determined by genetics or environment, but also by your conscious awareness and mental habits. When you learn to direct your thoughts with intention, to cultivate optimism without naivety, and to regulate your mental environment with the same care as your physical one, you begin to tap into one of the most underutilized, scientifically grounded tools for health, your own mind. This is not about denying pain or pretending life is easy. It's about understanding that what you think is not just important, it's instrumental. Your thoughts are not just in your head. They are in your cells, your blood, your breath. They shape the very biology you live through every single day, so choose them wisely.